So my next speaker is Dr. Ngatho Mugo from the Sydney School of Public Health, and she's going to be talking to us about pregnancy care in Myanmar. Thank you.
Thank you. According to the estimates developed by the World Health Organization in 2017, as you can see that Myanmar is rated is among the top Southeast Asian countries with the highest maternal mortality, estimated at 250 per 100 live birth, which is significantly higher than the average ratio of Southeast Asian countries, which is 100 estimate per 100 live birth. If you compare to Australia, it's just only 6 deaths per 100 live birth. Although the trends of maternal mortality have reduced for Myanmar between 2000 and 2017, it's still a lot of effort is required to achieve the minimum development goal target of 70 deaths per 100 live birth by 2030. Antenatal clinical care is critical and is defined as a care provided to pregnant women by a skilled healthcare provider, and is for prevention and treatment of the condition that might complicate pregnancy and childbirth. And early access to antenatal care is critically important for, and is associated with reducing complications from pregnancy, but also is important for identifying the women who could have a potential risk during the childbirth and referring them for further assessment. In 2016, the World Health Organization had a new guideline which recommended that women who are pregnant, they need to have 8 antenatal care services. Previously used to be 4 contact. And our analysis of results from Myanmar Demographic Health Survey have shown that about 18% of pregnant women in year 15 and 16 had recommended care of 8 or more antenatal care contacts. However, we still have about 14% of women who never attended antenatal care in Myanmar. Also, the world has recommended that antenatal care should be initiated early during pregnancy, well, within the 12th week of gestation. And our analysis of Myanmar have shown that almost about 27% of women initiated this care early in the pregnancy, or we still have another like 9% of women who started this pregnancy antenatal care a bit late during the 7 to 9 months of pregnancy. Just waiting for the next slide. Also, the world has recommended that the care should be, the women should be provided with adequate antenatal care services. And this could be like just some of the picture I put on the side. For example, measuring of the blood pressure, or giving them the injection for the tetanus, or giving them the supplements. And our analysis of the data have shown that about 58% of pregnant women had adequate care. And it's still about 12% of those women have severe inadequate antenatal care services. We also assessed some of the factors that lead women to use antenatal care services. And our results have shown that pregnant women who are wealthiest, they are 3 times more likely to use the recommended care. And those women, they mostly have a husband who work in non-agriculture related work, and they are almost twice as likely to use recommended care. And those women also, mostly they live in rural area, and because they are also they're able to pay for the private healthcare facility. So these are some of the factors that lead women to use recommended antenatal care in Myanmar. And our analysis also have shown that those women who had adequate antenatal care, for example, they went to the health facility and their blood pressure has been taken, the urine sample has been taken, and women who had the 8 visits for antenatal care, they tend to use the facility birth compared to other women, and they also will use a health care provider during the childbirth, and those women are twice as likely to use the antenatal care services than their counterparts. I don't know if you want to touch it or
touch it.
Touch it. Go and touch it. Yeah. You can touch it.
Yeah, you might have broken the timing.
Maybe I broke the timing
Yeah,
or something
so
like
just
this or
a quick
something. Thank you. We also did a predictive model, which is a statistical model, and we just assume it's a model that assumes that what will happen if we put all the pregnant women, for example, in the urban area. What could be the outcome of use of adequate antenatal care services? And we found that if all women in Myanmar, pregnant women, they're living in the urban area and no one else lives in the rural area, we'll have 70% of women having adequate antenatal care in Myanmar. Thank you.